Welcome to the Neuromodulation Podcast, presented to you by the International Neuromodulation Society. Dive into the forefront of today's emerging neuromodulation techniques, insights, and ethical and clinical applications. Subscribe now to join the multidisciplinary collaboration of medical care providers, scientists, and engineers who are part of the global conversation that's shaping the future of healthcare.
Hello everyone and welcome to our INS podcast. Our podcast topic today is Women in Neuromodulation, Opportunities and Challenges. I'm honoured to have today my guest, Dr. Kiran Patel from the United States. Welcome, Kiran.
Thank you so much for having me here.
Our absolute pleasure. I wonder if you could just, I know you very well, but I wonder if you could just introduce yourself in terms of who you are and where you're currently clinically practicing.
Sure. So my name is Kiran Patel. I practice as an interventional pain medicine physician. I'm board certified in anesthesiology and pain medicine. I am the director of pain medicine at Lenox Hill Hospital in New York City. I am also a program director for the Hofstra Northwell School of Medicine Pain Medicine Fellowship and train 4 pain medicine fellows every year, and the CEO and director of the New York City Neuromodulation Center of Excellence.
It's a busy clinical load.
I like to keep busy.
Exactly. So, I mean, this is our topic today, and look, I guess medicine has, traditionally a patriarchal past. I did a little bit of research in preparation for this to see that it was, I think 1915 was the first establishment of the American Medical Women's Association, and as late as 1873 we have the eminent Harvard Medical School Professor Edward Clark opining in public, quote, "Excessive education for women will leave them with monstrous brains and puny bodies." And I can't believe I'm even reading that to you, but nevertheless it's there as in the historical record. So I guess it's been a long journey that we've gone on in medicine to try and achieve gender balanced care. What do you feel that gender imbalance leads to or can lead to?
I think more and more it's important for patients to have physicians who represent all kinds of voices and can really speak to and communicate to a variety of patients. Medicine is all about communication. It's so much about the technologies that we implement as well, but in order to be effective in terms of patient selection, patient outcomes, we need to have that communication component. And that can be different for different patient populations. It's not even to say that women resonate more with other women. It may be that, studies have shown that actually in many male patients actually prefer female physicians because they find that they have a greater level of empathy.
Yes, that's true.
And so whereas we can't generalize to everyone, but everyone has a different voice. And if we say, physicians are all male and that's how we're going to keep this field, then we're probably not serving patients as well as we could. And I think that's really important to keep in mind.
One of the things I came across in preparation for this is that people talk about overt gender bias outcomes and non-overt gender bias outcomes. And I just wonder, what does that mean to you, or have you seen sort of things around that?
Yeah, I think I could think of many examples, and many examples from women who are in interventional pain medicine and women who are in neuromodulation. For example, I often hear stories where, in terms of surgical procedures in maybe a fellowship or a training program, that, the male colleagues are encouraged a bit more than the female fellows. That's one example. Similarly, in practice, I often, hear that the ability to trust, a new hire who's a female with surgical procedures on her own is not the same standard. There may be more training wheels, if you will, for the female physician than the male physician. And that could reflect a skill set, but I hear the pattern very much. And it's interesting, for my own trainees, I notice that the young men that I train are often much more confident and as they embark out into the world. And I would say their skill set, they could use a little bit more training wheels as they're entering practice, which is a great idea for anyone. However, I often see that the women whose skills are, fantastic, they don't have that confidence and they don't believe in themselves. And I think that reflects, years of training and subtle messages that have been given to them over the years.
And I guess if we look at neuromodulation itself, if we go back 20 plus years, which is not that long a time period, it was very male predominated. And that is changing. But even now, I think the figures are still relatively skewed in terms of any form of gender balance.
Yeah, and our field is unique. There's a lot of fluoroscopy involved, and that in any field, interventionally, where fluoroscopy is being used, we do find less women because of the concern of fluoro exposure, childbirth, and these things. But I would say that sometimes the environments also are discouraging. And I've heard those stories as well. I've had, female anesthesia residents who have said to me, I really want to go into pain, but it seems that it's so male-dominated, and I don't know if I'll ever be able to really excel in the field because of that. And that, when I hear that, even still, it's very concerning to me. And so I think what we can do and what we need to do, and why we have women in neuromodulation, is to really kind of create that mentorship and that example for those women who are in training of how they can kind of move through the ranks.
So I guess in one sense then, would be a mixture of, trying to reverse that from the bottom training level up as an individual, but also from departmental head setting attitudes from the top down. How have you in your own practice, running a system like this, how have you aimed to assist trainees?
I think the best thing that I can do, I'm in a position where I'm training fellows who are going to go out into practice and have perceptions about themselves as they emerge. And so I really try to keep all opportunities as equal as possible. And part of that, though, is not just giving everyone the same opportunity, which is one part of it. It's also understanding their skill set and who may need different types of development to get them all on the same level. And I think that's the key, is meeting the trainee where they are in their skill set and understanding where you need to take them.
Okay. And I guess on the converse, how do we perhaps encourage more advanced, occasionally elderly departmental heads, how do we encourage them to be proactive where that might not have been within their culture set?
Yeah, I think the one thing I try to do is highlight the positive things that my trainees are doing. And I think that is a great way just to let them shine. So whether they're male or female, if they've presented on an INS webinar, to highlight that to the department chair. If they have published an article in a peer-reviewed journal recently, highlight that. And so by having advocates, being advocates for the people who work with me or my trainees who report to me, I think that's the best way that I can try to change that culture. And when they're asking for volunteers to do projects and such, nominating, maybe the best serving candidate, really, whether they're male or female.
I've certainly had the experience in, designing scientific programs of designing, especially in my early days, designing a program and then it being politely pointed out to me, you've just designed a 100% male program. Are you telling me there isn't actually anyone? And then I stop and look at it and go, actually, there's all these people I could have do this. And now I'm aware of ensuring that I'm overcoming any natural sort of background drag, if you like, into that. How much do you feel that conversation around this is important to sort of reverse bias that might creep in inadvertently?
I really appreciate your perspective on that because you're such a leader in the field, and for you to be aware of that is huge. We joke, we call them manels. It's a panel of all men, they're manels. Right. And I do think that's important. I think it's not just that it's necessarily a bias, I think it's just not an awareness that, so whereas somebody may ask all of their colleagues, who are their contemporaries, to be on a panel, and they're all men, they don't necessarily have a negative intention, but they are not aware of the implications of that. And the kind of snowball effect it can have. If people don't see individuals on the stage, on the podium, on papers, who look like them or sound like them or come from similar backgrounds, it's discouraging. And I think we need to kind of open up the doors to allow us to have different viewpoints in science, in the patients that we recruit for studies, in the way that we communicate on publications, the way that we communicate science on the podium. And I think we as a field will be better for it. So I think for those individuals who are in organized medicine, I do think sometimes it needs to have a litmus check. And whereas it may not be your intention, you're just trying to bring in colleagues that you're familiar with, but sometimes we have to start to bring in people who can use a new opportunity. And I think many women in neuromodulation are among that group.
Exactly, and which brings us to the topic. So can you tell us a little bit about WIN?
Sure. So Women in Neuromodulation, I practice in the United States and was started with the North American Neuromodulation Society. And it was started by, a group of individuals. Was Dr. Lawrence Poirier was huge in that endeavor, as well as Julie Politzis and Andrea Trescott. And I was lucky enough to be probably the youngest female neuromodulator in that room. And it was really exciting and interesting. And it has become really this wonderful networking mentorship program, where our latest endeavor right now is doing a mastermind mentorship program where we have small groups where we meet quarterly, and it's on Zoom, and it kind of just talk about different aspects of training, and then also going through a curriculum of career development. So both allowing for more formal structure and then an informal structure, but just getting together and just talking about what's going on within, whether it's a trainee, whether it's somebody who's new in practice, somebody who's been a few years out, and somebody who's more seasoned, either in private practice or in academics. So it's really a great way to help develop careers where, in their local environment, many of these women are the only female neuromodulators. And so it's kind of nice to see how someone can say, hey, she's doing it, I could do that, and find inspiration and motivation and find a way to get from, I want to do that, but I don't know how to get from point A to point B.
Yeah, gotcha. And within the INS, we just saw WIN come up and really just realised this is fantastic, and we just wanted to copy it and provide that same opportunity internationally, hence where iWin came from.
Absolutely. It's been such a great opportunity to be part of iWin, because it's not just my local community in the United States. There's a shared experience there, but there's such a more broad experience from all of the countries where we have members and chapters for INS. And it's really fascinating because whereas in the United States, I might look and say, oh, there's some of these barriers to advancing my career. Some of my colleagues out there in other areas of the world have such more significant barriers, in addition to, the gender issue that may be present for them. They have resource issues, and together it's a lot to navigate. And I think that mentorship and that collegiality really takes on a greater importance.
So what are some of the current sort of activities that either WIN or iWin are engaged in at the moment?
I think the mentorship program is one of the best, just bringing the opportunity to connect individuals across different countries to find a source of professional development, whether that's skill set, whether that's how to introduce a therapy into your practice, whether it is how to take an idea for a research study into an IRB application, or how to, publish, how to navigate scientific writing, how to navigate statistics. So I think that's been amazing to help individuals identify what their goals are and what they're seeking for their career development, and pair them with a colleague who can help them get there.
So moving forwards in terms of the US landscape, what do you see are some of the challenges going forwards? Healthcare systems are under budgetary problems. How do you view things in terms of gender balance issues in the US? What do you think the next couple of years is going to hold? There's
a lot of changes right now in culture that is happening. And I feel, we see what's happening in universities around the United States and conversations that are being had. Fortunately, I have not yet seen this affect, the hospital system. I feel that the need for different voices of physicians to appeal to different patient populations is so ingrained in our system that I really feel confident that, and hopeful that we will continue to see the same push for diverse physicians to really appeal to diverse patient populations.
And I guess we've seen within family medicine practice and with obstetrics and gynecology, for example, really achieving up to gender parity in terms of job opportunities. And from my own perspective, looking at that, it's only strengthened those two particular fields. It hasn't weakened it in any way. So I think there's probably more opportunity to go in terms of neuromodulation.
Absolutely, and if we think about it, we know that right now in medical schools in the United States, there are more women in graduating classes than male physicians. So that's the pipeline of who's coming through the system. There are more female medical students, there's going to be more female residents, there's going to be more female fellows to some extent. So I think that pipeline is strong coming through the ranks. Yeah.
On a global perspective, what are people saying to you and what some of the global challenges might be?
Yeah, I think it's even more, it's multiplied of what I see and have experienced in the United States and what women in the US come to me and describe, because there are resource issues. I find that the challenges in parity are even greater in certain areas in other countries. And then in some other countries, I find that they're actually so much more advanced. And it's interesting. They're like, oh, we have equal amounts of anesthesia departments. We have equal amounts of neuromodulators, or even in neurosurgery. So it's interesting. It varies from region to region.
Right. One thing, and we see this a little bit in Australia, which is perhaps why I'm asking it, but overseas medical graduates that come from a completely different culture into then a new culture in which they're going to work. Some of the time they won't traditionally, culturally have had a voice or a strong voice or the ability to express themselves. How do they find a voice in this new culture when they also carry the experience, baggage is the wrong word, but experience of their previous culture?
Yeah, my parents, myself, came from India to the United States, and so I've had conversations with my mother about this and how when she arrived in the U.S., it was just so different, the culture of how she could speak more freely and give her opinion and just live in a different way. And so I think about this a lot, and I think that's the role of mentorship, to really help bridge that gap where people, it's not that they don't feel a certain way, it's that they're not used to expressing that, and they're not used to really, they're following their wildest dream, right? So yes. If their wildest dream is to, be a neuromodulator at a particular hospital system or a particular private practice, they may not necessarily pursue that because they don't have the confidence to believe in themselves. And so that's where I think mentorship, such as we offer here with iWin, is really an excellent opportunity to kind of build that.
Marginalisation, I think, can occur in any field. It's not just gender, it can come across religion and race and socio-economic status and so forth. So in a more general sense, how do you feel one should be able to self-detect bias that one could have in different fields? That's a hard question I'm throwing at you now. It's not an easy one. But how does one become bias aware, I guess?
It's interesting. Somebody once told me that we all have biases. And I agree. And I kind of think about that a lot. That, even when I feel like I'm trying to be the most balanced, there's always the potential that I'm being skewed in one way or the other. And I think exactly with your example, when you are developing a meeting, and you're looking at the panels, that you have to kind of stop and check and say, is there anyone that I'm not including, or is there something I'm doing? And it's kind of being aware of, it's not just being aware of the room and reading the people around you, because sometimes the people around you may not necessarily voice that. And I think it kind of has to come from within, just doing that kind of gut check and litmus check. Is there any type of bias that I'm introducing? Am I looking at things only in one way, or am I selecting individuals that are only a certain type? And how can I broaden that opportunity?
I think the way I look at it, I guess, is I view myself as ever changeable. So I am where I am in life, and I have good bits and bad bits, and I want to be in a process of continually eradicating the bad bits or the less than optimal bits, so that I continue to evolve as a human. I've used that as a technique.
I think that's fantastic.
To always say, I'm never the finished product. I can always be better, and what do I need to do today to achieve that? I don't know if other people do that, but it's a technique I've used to try and detect my own biases.
I think that's fantastic. And I also think that mentality is contagious in the sense where you influence people around you in ways that you don't even realize. But if that's the way that you carry yourself, the people that you work around inevitably will take some of that, and then they may influence others. I also think if you lead with empathy for your colleagues, for your patients, for your coworkers, I think really coming from that place will also allow you to kind of figure out, am I being biased in any particular situation? Because it kind of takes you outside yourself. If you always try to think about being in someone else's shoes or being outside your own shoes, that can then help you also identify that. But I think where your mind is at is fantastic, that constantly, how can we be better? How can we do better?
What do you hope for the future? If you could design the future, what would you like to see? I'd
like to see that there's more empathy out there for colleagues, for, also really looking at people and their skill set, and not just, in our field, we often see physicians who, will pick their friends for different things. And so for certain male physicians, that may be other male physicians. I would really like to see a more empathetic, more open-minded environment where it's really based on somebody's skill set or potential. And really, as a field in neuromodulation, that we can help kind of grow and develop that potential, whether it's in physical clinical practice, whether it's in the capacity to, produce high quality research, or whether it's also beyond that to, really refine somebody's ability to present scientific data.
Kiran, I'm so glad we have you as a thought leader in this field. It's been my pleasure to talk to you today, Dr. Kiran Patel.
Thank you so much.